My name is Roseline from Roseline Retirement Village in Johannesburg, a beneficiary with Christine Crossley with Meals on Wheels Community Service South Africa, a liaison to the Pass It On Network Paris, France. I'd like to share my experience as a COVID survivor. There are a number of challenges we senior citizens face when we have contracted the virus. Many of us experience a lack of resources, like difficulty to access to transport to take us to clinics and hospitals to get our treatment and medication. Some of us are lucky to have family and friends to assist in this regard. Others are not so unfortunate as they were sent here and forgotten about. We experience emotional trauma and loneliness due to the ignorance by the persons at the village charged with our care and safety. Also the ignorance of the residents who treat the people infected as lepers, which leads to feelings of rejection, depression, and with no food for sustenance. Myself and a few other would have also given up and prayed for death instead of focusing on getting better. If we did not have the assistance of family, a lot of us would have also had the same feelings of depression. My food and medication were supplied by my family and my care. The others were not so fortunate. There are various organizations like Meals on Wheels who donate various food items to their homes, but these never reach the needy due to theft and corruption. So a lot of the elderly that could have survived the virus do not, because of the ignorance, corruption, and the don't care attitude of the persons in charge of our care. We are exposed to verbal and emotional abuse on a daily basis. How can the elderly survive the virus under these conditions? There is a need for education so that everyone can have the correct information concerning the virus itself and how to care for oneself when you have the virus. There are so many negative factors that contribute to so many people having lost their lives and given up because they felt that they were of no use and nobody cared about them. So I think that with the lockdowns and the restriction in as far as COVID is concerned, that education is key so that people know what can and cannot be done for the aged. Thank you.